everyone, and welcome back to the FRG channel. We are back today with another video. We're going to go over a prone roll. So just a reminder, sometimes patients can be supine, which looks like this. However, that's not always the case. Sometimes they are actually prone. When you have a prone patient, you have to roll them. You cannot do any type of head-to-toe assessment. You can't move on to your secondary. You can't even do your primary in your scenarios without first rolling this patient because, well, they are face down. With that, you also have to make sure these prone rolls in our trauma scenarios, we're always worried about C-spine. So you have to be very delicate and be very careful when moving these patients to minimize the amount of C-spine damage. So we're going to go ahead and get into how to do a prone roll. Okay, now to actually do the prone roll. So, as primary, it is your job to instruct everyone else on where to place their hands. Tertiary, a very important job. Remember, all movements have to be on tertiary's count. So I'm going to go ahead and explain to my tertiary how he needs to hold his hands properly in order to ensure minimal C-spine damage for our patient. So, we are going to end up over here with your hands like this. So I want you to hold her head like this.
All right, so Taylor told me to end up here, so rolling this way. So I'm just gonna cross my hands over like this.
And just to reiterate, hold your hands how you want C-spine, the tertiary to hold the C-spine at the very end. Because remember, once they get in this position, that is when you'll continue the rest of your scenario. You don't want them to be with their hands awkward for the whole entire time before you're able to stabilize that C-spine yourself. So put your hands where you want the patient's head to end up, have your tertiary hold like this, and then you're just gonna have them twist like that. Okay. I'll be primary, he will be my secondary. So for starters, I'm gonna go ahead and take my patient's arm and I'm gonna put it lying up. We will be rolling her this way, so for her comfort, I'm gonna put this arm on the side that we're rolling her on up. I'm gonna hold at her shoulder and by her hips. My secondary is gonna interlock arms and is gonna hold by the waist and the lower leg. And then on tertiary's count, we're gonna roll her onto her side, so 90 degrees. On your count?
1, 2, 3.
Okay, and then on tertiary's count again, we'll go ahead and completely finish rolling her.
1, 2, 3.
Okay, now our patient is lying supine and we can go ahead and continue our assessment. Remember, for a prone roll, your time is paused, so you'll have time to make sure you do everything correctly, you instruct your tertiary correctly, and once you're done, your tertiary will be like that, continuing to hold C-spine, and your time will resume. Thanks for watching. Hope that helped. Let us know if you have any questions.